The inaugural Climate and Health Africa Conference has been hosted by the Center for Sexual Health and HIV/AIDS Zimbabwe in collaboration with the Zimbabwe government. Over 400 African researchers, scientists, policymakers, and international funders attended. The Africa Centers for Disease Control and Prevention stressed the severity of the climate change threat.
Africa CDC recognized the urgent need for collective action to mitigate the impact of climate change on human health, noting that the climate change is not just an environmental issue. Indeed, it is a health emergency. We've been experiencing the rising temperatures, extreme weather events, and changing ecosystems that threatens our own existence.
The Zimbabwe government says the conference was important for the continent.
We need to win this battle, to work tirelessly to protect people against climate change, the greatest threat to their health in our time now.
The conference organizers say it was a meeting of great minds on climate change.
The Climate and Health Africa Conference is a convening for scientists, policymakers, early career researchers, and seasoned researchers together, along with activists and legislators, to talk about emerging evidence in the continent and how that can shape policy action and implementation at the community level.
Africa is responsible for less than 10% of greenhouse gas emissions, but is most vulnerable to the effects of climate change. Pindai Dube, Harare, Zimbabwe.